during awake surgery, I'm able to kind of have, ownership over my body. We can talk about it, and that feels really empowering. And
Right. We've got a patient here with lipedema that's had multiple surgeries, and the interesting thing to me is that she's willing to share her experience about previous surgery that she had that was under general anesthesia, and then she's had a couple surgeries here with us now with her being awake the whole time. So just in your own words, can you kind of tell us the difference between your previous surgeries and this one?
The hardest thing about my previous surgery was absolutely going under. The pain for recovery is really not that bad with liposuction, but what I found most challenging was recovering from the anesthesia, the cognitive difficulties that I experienced. Just feeling lethargic. It really affected my mood for several days, which was really, really hard. I was really nauseous. All of those things kind of went away after doing the awake surgery.
And then immediately after surgery, you kind of talked about that a little bit with general anesthesia. Now that you've had a couple awake procedures, do you mind talking about like how you feel as soon as you're done with procedures like you are like right now?
Yes, right. Like I think the fact that I'm able to sit here and have a full conversation with you is a real example of the difference. When I came out of the anesthesia, I was really groggy, dizzy, nauseous. I threw up like immediately.
Right.
I was out for several days, recovering cognitively, emotionally.
Like what stories did we talk about? What
Yeah.
kind of stuff do you remember from today?
Oh yeah, absolutely. I mean, well, we talked about Ty being able to do a body roll,
Right.
and I think we even got him to practice a body roll and
Right.
get there fully.
Right.
We talked about culture. We talked about our what's been going on in our lives, and it was very fun and easy. And I think being able to connect with your surgical team while the process is happening is really, really empowering, just to be able to have that sense of like, I can lean over and ask you a question, or you can ask me how my pain levels are, and like just having the ability to do that feels a lot safer to me than just being in that place of, twilight anesthesia, not really sure what's going on, people moving around. During awake surgery, I'm able to kind of have, ownership over my body. We can talk about it, and that feels really empowering. I think just having that level of awareness of what's going on with my body throughout really, really helps a lot.
Just for full transparency and disclosure, have I compensated you for this in any way?
Absolutely not. No, okay. No. I actually offered because of how positive the experience has been, and I want to share that with other people because I think, like I said to you, lipedema is a really sensitive, emotional experience, and it helps a lot to really feel like you have a voice and that you can interact and communicate with your surgeon, and to have that sense of like ownership over your body throughout is really, really important. So I want people to have that experience.